Today is Wednesday, August the 26th. We are in week 25 of the COVID pandemic here in Montgomery County and our 9th week in the green phase. Since the August 25th press release, we have 40 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 10,642. These positive cases are a result of a positive test for the virus, not from an antibody test. All 40 of these cases are from the community. 39 of these tests are from the last 7 days or less, which is a substantial improvement in our test turnaround times. These positive individuals are from 23 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 6 years old to 72 years old. And as always, you can check our county map found at montcopa.org/COVID-19 for updated geographic information. Today we have 27 females and 13 males. I am pleased to confirm that no additional Montgomery County residents have lost their life to COVID-19, which leaves us at 826 deaths confirmed positive from COVID-19. In terms of hospital beds, we're holding steady from last week. Today, we have approximately 48 people that are hospitalized with COVID-19, with 7 of those individuals on a ventilator, or approximately 14.5%. Update from our Montgomery County Correctional Facility. As I've been reporting, since Sunday, August the 2nd, a total of 24 inmates in the general population have tested positive for COVID-19. 2 of these individuals required hospitalization. 1 of these has recovered and returned to the correctional facility. However, I'm sorry to report that the second individual, following a 10-day hospitalization, has died from COVID-19. This is the first death from COVID-19 at the Montgomery County Correctional Facility. We extend our deepest condolences to this individual's family and loved ones. This individual had been incarcerated since mid-2018, was over 60 years old, and had 3 underlying medical conditions that are associated with an increased risk of mortality from COVID-19. All other inmates are currently stable. Additionally, 15 regular staff or medical staff at the correctional facility have tested positive during August, and they are all currently stable. As you may recall, we tested all inmates and staff at the Montgomery County Correctional Facility, April 23rd and April 24th, 2020. At that time, we identified 171 inmates who tested positive for the coronavirus out of 942 inmates tested. These individuals were isolated and any cellmates or other known contacts quarantined. A few weeks later, 1 inmate from the group that tested negative for the virus began showing symptoms of COVID-19 and tested positive. This was a trigger for us to retest any inmate who had previously tested negative. That testing was undertaken on May the 21st. A total of 716 inmates were tested and 90 inmates tested positive. These individuals were isolated and contacts quarantined. All of those inmates remained stable. All staff at the correctional facility were retested on May 28th and 29th. Of the 400 individuals tested, 8 correctional facility staff tested positive and 7 medical staff tested positive. All were placed in isolation and their direct work contacts quarantined. Since that May testing, there were no cases of COVID-19 in the general population until August the 2nd. Working with Prime Care, the medical provider for the facility, we will undertake a 3rd round of testing of inmates and all staff in the correctional facility beginning later this week. Since the President Judge issued the initial March 12, 2020 order declaring a judicial emergency, the population in the correctional facility has gone from 1,342 to 818 today, a net decrease of 524 or 39%. Since March 13th, there have been a total of 1,865 discharges. A community testing update. I'm pleased to announce that testing continues to go smoothly in our second week with Mako Medical. For these past 10 days, results have been available within the contractually promised 36 hours. As of this past Monday, we have increased our testing capacity to 50 tests per site per day. This will provide 300 tests per day across the county sites. And we intend to increase our capacity again in mid-September. As a reminder, the county now has 6 COVID-19 testing sites open around the county. None require a car or a doctor's prescription. We do ask that you make an appointment. All appointments are made the day of testing beginning at 8:30 in the morning. You cannot book ahead. We do require that the person being tested either live or work in Montgomery County. And these tests will be provided at no cost, but we will bill your insurance if you have it. The sites are located in Pottstown, Lansdale, the First Baptist Church of Crestmont and Willow Grove, in Green Lane, Ardmore, and Norristown. To see the exact locations of all of our sites or to register for a test, you can go online at macopa.org/COVID-19 and click on the green County Testing Information button. And as I said, appointments open at 8:30 in the morning on the day that you would like to be tested. We test Monday through Friday. If you would prefer to make an appointment by phone, you can call 610-970-2937. Also beginning at 8:30 in the morning of the morning that you would like to be tested. We do have Spanish-speaking operators as well as the language line available by phone. Working together, we continue to suppress viral spread here in Montgomery County, but our data does show a small uptick in numbers, which reminds us that we cannot let up. Keeping the spread of virus low will enable our businesses to stay open, facilitate our children returning to in-person school, and keep our hospitals and first responders safe. So now let's move to our weekly graphs. First, our date of test graph, which you should be able to see. As a reminder, the gray bars in the background are any individuals that have tested positive on the given date. And then we have our running averages. So the dark red line is the 7-day average. The pink line is the total 14-day average. The darker blue line is the community 7-day average. And the lighter blue line is the community 14-day average. And so, Tim, if you can switch to the zoomed in version, it's a little bit easier to see at this point. These numbers are through August the 21st. We always have a several day lag because it takes time to get enough test results back to make this data meaningful. But you can see that we have been slowly creeping up here over the last several days. And this is something to keep a very close eye on. This definitely serves as a reminder that this virus is very much still with us and is still extremely contagious. And so whenever we sort of get a little lax in our behaviors and our social distancing and wearing a mask, it doesn't take much for our numbers to start to tick up again. We'll move on to our positivity graph. And today our positivity rate is 3.07. And again, this is an increase. So these are, and just as a reminder, these are 14-day PCR, the test for the virus, positivity rates. That's represented by the blue line. And then the orange, very jaggedy line is the number of people that were tested on any given day. And so you can see that we continue to slowly trend up in the total number of tests that we are doing, which is terrific. And you can see just a small uptick there in our positivity rate in that blue line. So again, as of 8/21, we were at 3.07. A week ago, we were at 2.82%. So again, these are not alarming increases, but these increases definitely serve as a reminder that we must continue to not leave home without a mask, and always put that mask on whenever you are within 6 feet of someone who's not in your household. Do your best to keep 6 feet of distance from anyone who is not in your household. Keep your hands clean and away from your face. And if you need or want to be tested, please get tested. We have a lot of great and easy to access testing capacity around the county. And the more people that get tested, the more we know. And then finally, if you do test positive or get a call from someone who identifies themselves as a contact tracer, please cooperate with that call. As a reminder, contact tracers never ask for social security numbers or any kind of financial information. They do not ask for a credit card number. None of this is at any cost to you. They should be just asking standard questions about who you may have been in contact with in recent days. So I want to share a story with you. Actually, before I share the story, let me give you two other updates. First is that we now have 97% of the people that we are reaching cooperating with contact tracing. So that is fantastic. Good work, everyone. It would be great if it were 100, but we're really getting close with 97%. The challenge that we face is that we are reaching 70% of the people that we attempt to contact. And we believe we have good phone numbers, and we're getting voicemails. We leave voicemails, and the contact tracers do not get a call back. So again, please, if you get a call from a contact tracer, please call them back. It's extremely important. And I'm going to share this following story with you as an illustration of why it's so important to cooperate. In early August, there was a party outside of Montgomery County that multiple Montgomery County residents attended. It was later identified that there were individuals at the party that were infectious during the party and later tested positive for COVID-19. Once the positive individuals were identified, the local health authority reached out for contact tracing. At the time of the contact tracing, the positive individuals were not willing to provide the names or contact information of the attendees at the party. Because the names were not provided, these individuals were not notified of the need to quarantine, and they were unaware that they had possibly been exposed and that they had risk for developing COVID-19. So these individuals continued their daily routines, including going to work, school, and other gatherings within the Montgomery County community, unaware that they had been exposed. Within 14 days from exposure, several of these individuals who live in Montgomery County became symptomatic and tested positive for COVID-19. But before they knew they'd been infected, these individuals came in close contact with multiple other individuals and were not social distancing. So this has resulted in the need for extensive quarantines of individuals associated with a camp, a school, workplaces, and a social gathering. And at least 3 individuals from this social gathering have now tested positive as a result of their exposure to these other people. So these cases and all of these quarantines were preventable if the original people involved had simply cooperated with contact tracing and let the contact tracers know who was at their party. These calls are not judgmental. Cooperating with these calls is how we keep our community safe and how anyone who needs some support in order to quarantine or isolate safely is able to do so. We've also seen a recent outbreak in a workplace where workers are required to work less than 6 feet apart. I do want to remind all business owners that if your employees or a portion of your employees can work from home, please allow them to do so. If employees must work less than 6 feet apart, please make sure that all employees are wearing masks and consider adding face shields, sneeze guards, or gloves as the work allows. All these things will be added measures of safety when you cannot maintain that social distancing. Also, please make sure that the filters in your HVAC systems are clean and that the system is providing as many air exchanges as possible. These simple steps can help keep your workforce and our community safe and healthy. So a couple of other updates. First, the Pennsylvania Utility Commission is voting soon on whether or not to lift the moratorium on utility disconnections. On behalf of Montgomery County, I have written a letter to the PUC asking them to extend that moratorium, given that we currently have approximately 51,000 unemployed Montgomery County residents. So if you are concerned about your utilities, the Low-Income Home Energy Assistance Program may be available to you. This is the program known as LIHEAP, and typically this program only runs in the winter. But because of COVID-19, additional funding was put into that program. And if you experienced a sudden loss of income due to COVID-19, LIHEAP may be able to help pay some of your home energy costs. The key thing here, though, is the deadline to apply is this coming Monday, August the 31st. So you need to get that application in quickly. You can do it by phone by calling 877-395-8930. That's 877-395-8930. Or you can apply online today by going to www.compass.state.pa.us. So one more time, that's www.compass.state.pa.us. And I encourage you to take advantage of this program. The application is simple, and we have been told that there's quite a bit of money still available. So if you qualify, your chances of getting some additional funds are very, very high. Second, I just want to update people on evictions and foreclosures. So as you may recall, the Governor Wolf had placed a moratorium on evictions and foreclosures until August the 31st, which is next Monday. Yesterday, the governor announced that he does not have the legal authority to extend this moratorium and has asked the state legislature to do so. We will be sharing information with our Montgomery County state delegation this week about why it is so critical to extend this moratorium. We are also working on a rent relief program using CARES Act funding that could supplement the current program that the state is running, but that program has not proven to be adequate for Montgomery County renters. Currently, Montgomery County has approximately 96,664 renter households. In a normal year, there are about 6,000 eviction cases filed. The National Low Income Housing Coalition has stated that 29 to 43% of renter households are at severe risk of eviction by the end of 2020 due to the impacts of COVID-19. So that could mean anywhere from 23,000 to 47,000 households in Montgomery County. Obviously, that would just be catastrophic for every single person involved. So please, if you can, reach out to your state representative and your state senator and let them know how important it is to continue the moratorium on evictions here in Montgomery County. So that is all I have today. Our next virtual briefing will be Wednesday, September the 2nd. I can't believe September is almost here. Wednesday, September the 2nd at 3 p.m. And with that, I am happy to take questions.
Great, Commissioner. This afternoon, we are joined by Jim Melbert from KYW.
A couple of questions from things you said. Is there any information on the Montgomery County Correctional Facility inmate on where he may have gotten it? Did he have contact with someone who was positive? Anything along those lines?
We have not been able to determine with certainty how he was exposed.
And are you releasing his name or any more details on his age or why he was there?
No. I can refer you to the district attorney who might be able to answer questions about his charges, but I cannot do that.
With the party, the out of county party that you were talking about, you talked about a number of quarantines. Is there any ballpark on how many quarantines resulted from that, or any guess? Or
No, I don't actually have that number, but I was told that it was quite a few. But we can try to get that number for you.
and similar question on the workplace outbreak. Any information on what industry that was?
I not that I can share.
And is there any, again, similar question to before, any ballpark or number of how many positive cases or quarantines resulted from that?
Yeah. Again, several, a number, and we can try to get you those exact numbers.
Okay. And I did want to ask, separate from what you've talked about, as schools, as people get ready to go back to schools, a lot in the county are starting virtually, but eventually there's the possibility that kids will be back in classrooms, and with that comes the likelihood that there will be a case, some cases. What's the discussion been with school districts on how to not only handle that from a, keeping classrooms or schools open, but also just kind of messaging to parents? Is there talk of how to let people know how to communicate and to kind of, I guess, manage the reaction to that?
And do you specifically mean if there is a positive case in the school?
Yeah. Yeah.
Yeah. So there will absolutely be positive cases in schools. And I think we've been very clear about that. There is really no getting to zero and for the foreseeable future. So each school and each family has been going through a process of making a decision about risk factors and the schools in particular about the ability to social distance, working with their teachers and other staff to make sure people feel safe. So we're seeing a wide range of responses around the county. The majority of schools are going to be virtual. We have, I believe, 5 or 6 school districts that are bringing some students back, and it varies across those districts. So when there is a positive, the Montgomery County Office of Public Health will be working very closely with these schools and particularly with the school nurses. And there's already been a process in place to identify those contact people. We have asked all the schools who are doing any in-person to keep very good seating chart lists and attendance lists so that we will quickly be able to know who might have come into contact with that student and whether or not they were able to be socially distanced from that student and all the relevant information that we would need to communicate. The County Office of Public Health will communicate with that student and their family and any direct contacts or any individuals that we think are at risk of exposure, which means that they were within 6 feet for longer than 15 minutes. And then we will work with the schools, just like we do when there's any outbreak, whether it's measles or head lice, to work with them on the messaging that they want to share with their school community. So we'll work in partnership with each of the schools on that.
And understand this is a bit hypothetical, and it would vary depending on how the case or contacted, et cetera. But if there is a case, does it automatically mean that the entire school would just have to shut down, or could it be, even other kids in the classroom are okay, and a couple of kids maybe have to quarantine? Do you envision that? Is there a way to kind of answer that?
Yeah, absolutely. In fact, if you look at our school guidance up on our website, I think there's a chart that is talks about what we call exclusion criteria. So if just one student in a school tested positive, hypothetically, and they were in a classroom where social distancing had been maintained and all the other recommendations were in place, then definitely not would the whole school would not have to close. And again, depending upon the situation in that particular classroom, maybe a couple students might have to go out, but again, the intent would not be to close the whole classroom. However, if there were multiple positives, depending upon whether it was, let's say 2 children in a classroom, well, then that classroom would probably need to go home to quarantine and continue their learning virtually. If there were students that simultaneously became positive in multiple different classrooms or locations within the school, then that would be the type of thing where we might look at something more broad. So it really will have to be a individual decision depending upon the specific circumstances of that location. But we've talked through all of this extensively with our school superintendents. We continue to meet with them pretty much weekly. And, I think they are all, very prepared for this. I mean, particularly the ones that already have some people coming back. They are plugged in with us, and we're ready to help.
And this is really your area, but I'm curious with supplies, things like Chromebooks. Have you heard about any districts having issues getting Chromebooks as people prepare to go virtual? Is that something that the county would even help with or could help with?
I haven't heard specifically. You mean actually like getting enough Chromebooks? I haven't.
Yeah, just because so many
Yeah.
districts right now across the country are trying to get the same things. And I didn't know if that's
Right.
not.
Yeah, I haven't actually heard that. I remember hearing in the spring difficulty getting hotspots, but I haven't heard anything about any Chromebooks recently. Just as a reminder, the county has allocated a total of $15 million to our schools to help with all of the things that they need to get in order to switch to a virtual learning platform. And one of the things that we have helped them with at their request for those that wanted to is purchasing some PPE. They were really struggling to get access to large quantities. And so over the summer, we offered them the option of adding into purchases that the county was making. We do have a fair amount of purchasing power as a county of our size. So we have assisted them. They're paying for the PPE, but we literally ordered it for them. Excuse me. But I'm not aware that we've done anything with other equipment. We'd be happy to, excuse me, I have something in my throat. We would be happy to help them if they need it and if we could get what they needed.
Gotcha. That's it for me. Thanks.
Great. Thank you very much, Jim. Commissioner, we also have I believe, some questions from reporters who could not be with us today. So we'll send it over to Teresa Harris.
Mm-hmm. Yeah, there are a few questions from Deanna Durante from NDBC 10. Yesterday, Montgomery County released guidance as it pertains to school sports. First, given the current pandemic, are you supportive of students playing sports?
We did release guidance yesterday and met with all of our school superintendents to review that guidance. And first of all, let me put that guidance into some context. So as those of you that have been watching these briefings know, we've had youth sports playing in Montgomery County, all over Montgomery County all summer, multiple different sports. And that has been the case since we went into the green phase on June the 26th. So we've looked very, very carefully at that data. And what we have found from our contact tracing is a lot of exposure to virus. However, the only documented cases of transmission in any of these teams happened on teams where there was also a social event around a game. And so we cannot say with certainty if the transmission happened on the field or at the social event. So if you look at our guidance, which is now on our school guidance page on our montcopa.org website, one of our recommendations is that there be no social gatherings of these teams of any type. We are recommending that the schools follow the CHOP Policy Lab guidance for school sports, which we think fits very well with our situation here in Montgomery County. And under that guidance, we would recommend the low contact and the moderate contact sports being allowed to proceed given our current numbers here in the county. So that would include things like golf, tennis, swimming, soccer, I believe lacrosse is on that list, and field hockey, which is typically a spring sport for girls. But I think those are the things on that list. And right now we would recommend against football, wrestling, water polo, and basketball. Now, the PIAA, which is the Pennsylvania Interscholastic Athletic Association, has voted to allow the school districts to make the decision themselves. And so we are working with our school districts. We're providing any guidance they need. We're answering questions. But each of our 22 districts has a independently elected school board. And this is what they're there for, is to make these decisions for their school districts.
I guess that goes to our next question, which is if the school were to choose to play one of the sports that you're saying, like football, shouldn't be playing, then will there be any penalties from the county?
There won't be any penalty, but as we explained to the superintendents yesterday, we will obviously be keeping a very close eye. And should we see transmission in any of those sports, then we would require that they stop playing. But, you know, I do have to say we've had 2 months, a little over 2 months now of sports, and so far have not seen any transmission. So we'll see how this goes. We are going to keep a very close eye on it, but we would continue to recommend not playing those high contact sports. Our numbers really don't justify that will be particularly safe.
Her last question is explaining any special rules that come with the sporting events, such as limitations on spectators.
Mm-hmm. So a couple of important rules. One, I already mentioned the no social gatherings. Two,
Right.
People should have masks on unless they are literally out on the field. And on the sidelines or dugout, whatever it is, people should be socially distanced with masks on. That includes all players and all coaches. In terms of spectators, we have decided to allow spectators that are in the guidance of the governor's opening orders. So what that means for anything indoors, there can be no more than 25 people, which includes the players, the coaches, and the refs. So indoor sports, I wouldn't anticipate there be any spectators. Outdoors, we did tell the schools that they can have up to a total around the field of 250 individuals, which is the maximum for an outdoor gathering, but only if they have a stadium that can accommodate that many people socially distanced. So each household has to be at least 6 feet away in the bleachers from any other household in all directions, and that every one of those spectators must have a mask on.
Okay, that's all the questions that she had.
Okay. All right, so that's it. Any other questions? All right, well, thank you, everybody, and we will see you next Wednesday. Take care. Thank you, Megan.